Frozen shoulder is an extremely painful condition, affecting the mobility of the shoulder joint. Sometimes it can develop following trauma, but not always. It can just gradually come on and get worse. It will generally happen between 40 and 60 years old and be more common in women. The worst part of frozen shoulder is how long it can last, typically for around 18 months to 2 years. If you've got thyroid issues or you're diabetic though, you're more likely to get it and it's more likely that it will last longer. We've got exercises you can do for frozen shoulder in this video, and we'll talk about what other things can be done to help it. Frozen shoulder is typically characterized by restriction globally to the shoulder in all directions. So a lot of the exercises will focus on mobility work to try and improve this. Due to the length of time it lasts, it also really is important to work on strengthening exercises. A lot of time this gets missed from rehab programs. But you can imagine if you're not using your arm properly for 18 months or more, it will get very weak. So this is to help minimize issues following recovery. Starting with mobility work, you'll need a stick for this. A broom handle, whatever, anything like this can work. And we want to hit an exercise for all the main movements. Exercise number 1. For this, you want to be laying down and holding a stick with both hands while keeping your arms straight. You're going to try and move the stick as far overhead as able, using the non-affected arm to help the range of the affected one. For any of these exercises, it's generally okay to feel some discomfort, but we would advise to draw the line at a grimace. If you're going as far that it's making you grimace, then just back off a little so it's more tolerable. You'll likely find it very frustrating with exercises that you're not getting lots of increase in range quickly. That's very normal. A lot of these help with keeping the range you do have and stopping it from getting worse. Next up is exercise number 2. This can be done in either laying or standing. With elbows close to the side, bent at 90 degrees, you're working to externally rotate the shoulder, using the non-affected side to assist in pushing the affected side. Again, same applies, a bit of discomfort, but not grimacing. Next up, exercise number 3. Again, using the stick, this time in standing, keeping the affected arm straight, you're going to move into abduction, using the stick to gain assistance from the other side. Again, just to edge out slightly more range. Same guidance applies to pain levels. Last for the mobility section is exercise number 4. Depending on severity and range you have, there's slight adjustments you can make with this one, which we'll cover in a second. But this is to help increase the range of the hand up behind the back. So using the stick, you'll use your other hand to help pull the affected arm up the back. For some, just getting the hand up towards the back may be too painful. In that case, you can make this easier by having the stick low and pulling the hand across to the other side, to then gradually build up into the other one. Again, back off if grimacing. Moving on to strengthening, you'll have less range than normal. So you need to do some adaptations to normal exercises. You also won't be going into much pain from the frozen shoulder. Only muscle pain from doing the exercises. Exercise number 5. This is similar to exercise 2, but you will now use some resistance to build the strength. The nicer way to do this when having frozen shoulder is to lay on the opposite side with the affected arm resting on the body, elbow bent to 90, then using a weight. Lift it to whatever range is tolerable. This can be made harder by increasing weights. With this, you'll also want to do exercise number 6, where you'll be working on internal rotation. This is slightly harder due to the lack of external rotation range, so generally easier to do with a band or a cable machine. Again, elbow at 90, but this time bringing the hand in towards the body, making sure the resistance is in the opposite plane. You won't get much benefit if just holding the weight and standing doing it, as the resistance is in the wrong plane here. If you don't have bands or cables available, then you can just use your other hand or a wall for the resistance. Another to add in for strength would be exercise number 7. Using a weight again for this one, this time keeping the arm straight, raising up in a scaption plane, so in between a front and lateral raise. Again, this can be built up changing the weight. So What other things can help? Well, frozen shoulder goes through stages. It used to classically be said it was 3 stages: freezing, frozen, and then thawing, all lasting 6 months. But generally, it starts stiff and very painful. This, again, very loosely typically can last around 9 months. Then the pain can start to settle, but the stiffness remains, normally for another 9 months. And then it starts to ease. During that painful stage, it can make exercises difficult. And this is where a corticosteroid injection may be helpful to facilitate completing the exercises. It can help reduce the pain felt, and in some, help reduce the stiffness as well. It's not a guarantee that it'll help everyone, and with going more invasive and using this treatment, there are more side effects, which should be discussed with your healthcare provider. You should, by this point, have had an X-ray of the shoulder to show a clear glenohumeral joint, which basically rules in a frozen shoulder if you have shoulder restriction. To guide you through the exercises, we have a companion video to this here, which goes through how to plan the reps and sets, which will be especially useful for the strengthening exercises. So check out the modifications and rehab part of that video for the most relevant information.